Hi, my name's Elizabeth, and I'm mom to Emily, who's 3 and has spina bifida. For parents who have just received a diagnosis that their child has spina bifida, I tell them that it really is going to be okay. There's probably a lot of very scary medical information that you're receiving from the doctors, but at the end of the day, you're going to give birth to a beautiful baby. You're going to love that baby unconditionally, and everything that you'll be facing in terms of medical needs or therapeutic or developmental needs will become your new normal, and you'll just get it figured out like you always do as a first-time parent. Some things that have become the new normal in our lives since Emily has been born with spina bifida have been arranging our schedule for an increased amount of therapies. There are a few medical responsibilities that you have to do in terms of surgeries, which can be frightening but are also necessary for the condition. But there are some additional medical things you're taking care of during the day. The things that I think are most important for families who are not raising a child with a disability to know about are that these kids are just like every other kid. They may have some things that make them individual, but the beauty of it is that's what we all have. I might wear glasses and she might use a walker, but everybody has their own individuality. The biggest piece of advice I'd say not to do is to not stare without asking a question. There's absolutely nothing wrong with coming up and saying, what's her diagnosis or why does she use that to help? I find that the best thing that can happen is when kids come up and ask her, and they always have a great personality because I tell them what she uses it for. She needs a little bit of help walking, and they say, oh, okay, and they move on and they're done with it. So it's great for them to come up and ask. I say, don't be afraid to come up and ask. Just make sure you ask it the right way. I'm extremely happy that she's growing up in a day and age where there's such an advancement in the technology and such a big movement to be more encompassing of people with disabilities and with differences. My biggest hope for her individually is that she's independent, she's confident, and that she just enjoys life and has a great future.